Hello, everybody. I'm John Sahly. I'm the digital editor here at Shaw Media. I'm joined by Northwest Child reporter Kelli Duncan. And we are joined today by an expert panel to discuss where we are in the COVID-19 pandemic, vaccines, schools, getting those vaccines into arms, all sorts of important stuff today. We are joined today by Dr. Irfan Hafiz, an infectious disease specialist with Northwestern Medicine, Melissa Adamson of the McHenry County Department of Public Health, and Dr. Scott Rowe, Superintendent of Huntley School District 158. Thank you to everybody for taking the time today to discuss a very important topic. I want to start with Dr. Hafiz. We have two vaccines, one from Pfizer, one from Moderna. It's a messenger RNA vaccine. Can you explain what that is and how it works?
Sure, thank you for having me. So right now, the two vaccines that have received emergency use authorization are mRNA-based vaccines. One is from Pfizer and one's Moderna, as you already pointed out. The important thing to note here is that in the past, all vaccine, the principle is to produce a protein that the body can recognize, that to which the body can produce antibodies. So you want a protein from the virus or germ, whatever you're trying to create the vaccine for, an important part of that protein, so the body recognizes it and can start to block that. In the case of using mRNA, and I'll get to a little bit of why this is a great process in a little bit, but the basic principle is that all proteins are made by an mRNA molecule. And by jumping ahead and looking at the virus, we know on the outside of the virus, there's little proteins called spike proteins. So if we take that protein and figure out what mRNA would be needed to make that spike protein, now we can create antibodies to that spike protein that in effect block that virus from infecting the host there. Those spike proteins are really essential to be able to, and they attach to receptors in our nasal passages, in our airways, and in other tissues in order to penetrate in. But if we can block that protein, then we have blocked that effect of that. In the past, we would actually take parts of the virus, break it down with chemicals, and then try to produce a protein similar to that or inactivate it. The mRNA technology allowed us to create a vaccine far quicker and in larger quantities than we could have with the old technique. That's really the difference.
All right, Melissa, everybody wants to know, when can I get a vaccine? Can you explain where the county health department is on this, some of the challenges you faced, and what you're doing to overcome them?
Yeah, so again, thank you for having us. It is a very hot topic. I want to start by just letting people know that the state rolled out the vaccine at different times. So oddly enough, because we did better on our death rates, we were not among the first 50 counties to receive the vaccine. So some people received it, I believe, as early as December 16th. We got our first doses on December 28th. And we actually held a clinic that week for emergency responders like EMS, right? So as soon as we get it, we try to get in the arms of those priority groups. So right now, or at the start, right, the priority group was phase 1A, which is frontline healthcare providers. Since then, that group continues to expand, so the state continues to add eligibility, if you will, people who qualify for 1A. So we've been hosting clinics every week since we started. We are still vaccinating 1A. Actually, last week was the first week we were able to start second doses because the initial vaccine we got was Moderna. So Moderna, you can give 28 days apart for that second dose, and Pfizer is 21 days. So because we got Moderna initially, those first second doses started last week. We also concurrently started opening up to phase 1B. The governor announced on January 25th that the state was going to 1B, but every county is a little different and everybody's not in the same place. So we were starting our second doses with 1A. We also, as we had slots in our clinic, would open them up to 1B. We are prioritizing with 1B the 65 plus population because they are at higher risk. So that's kind of where we're at now. I know Scott's probably, I don't want to steal Scott's thunder when we get to him, but we have been working with the schools and have plans to unroll and stand up some points of dispensing to get teachers enrolled. But I will say, I think people are frustrated, right? Because there are few appointments right now out in the community, but we are also working with our community partners, like our hospital systems, other community health centers, pharmacies in our community to distribute vaccine to them to assist in our vaccination efforts with 1A and 1B.
All right, I want to go to Dr. Rowe here. It's been a hot topic for a while now, getting kids back in school safely. There's a lot of complex components to that. Let's start with vaccinating your workforce, being in phase 1B that Melissa just mentioned. What are the challenges and successes you've seen so far with that effort?
Well, we have, as noted in a press release, actually, that'll be distributed a little bit later today, we are just set the dates for when educators in the county will be vaccinated. They'll be vaccinated on February 11th and 12th, so sooner than originally was planned. So it'll be updated in a press release released this afternoon. Last week, the health department released some information that they were targeting the 3rd or 4th week of February, but now it looks like we're going to be able to get it done much sooner, which is a huge positive. In terms of the process, you go back to thinking about what schools are really good at. We're good at organizing people and getting large groups of people into spaces. So we're going to be able to vaccinate 6,000 people over the course of 2 days. Every educator in the county at either our location at Huntley High School or at Woodstock North. And we've got a pretty tight process that we have to be able to vaccinate upwards of 50 people per hour, or 200 people per hour, 200 people per hour over 2 long days. So I think that's where we have the facilities, and they're large enough, the parking to accommodate those that are looking to be vaccinated. And I'm also very happy to report that our staff has responded extremely positively to willingness to be vaccinated. We're anywhere between 80 and 85%, at least in Huntley, of our staff that are interested in receiving the vaccination, which is a huge positive by all statistics that I've seen.
All right, I want to go to Dr. Hafiz for a couple of minutes to just debunk some information that is probably out there, some misinformation that's been out there about the vaccine kind of as we've gone through the process here. We've heard concerns from people that this was rushed, there wasn't enough testing, there's concern about long-term side effects. What could you say about the safety of these vaccines?
Sure, just a couple of things on that. You touched on a few interesting points. Yes, the overall timeline has been compressed, not from necessarily from losing safety. A couple of things. One, we needed a vaccine quickly because of the extent and the number of people that were affected. We were losing more than 1,000 lives a day for a while there in December. And with the current treatments that are out there, that have been out there, we've known that they've been insufficient. They're just not good enough. And as history shows that with any viral infection, the true turning point is development of a vaccine. So therefore, a lot of resources were placed on vaccine development, but also using the current technology, especially using that mRNA technology we talked about earlier, we were able to compress a lot of that development time. A lot of the genetic coding that we can now do. We were within 30 days of the virus being identified first at Wuhan, being part of a pandemic. Scientists were able to find the genetic code because of the current technology. That would have taken years, 10, 15 years ago to do. We were able to do that in 30 days. And then within another 30 days, another 60 days, they actually were able to extract the protein on the surface that allows the virus to infect. So a lot of those years that would have taken to develop this were compressed because of the tools that we currently have. Then that being said, once we did have a candidate vaccine, there were about 40,000 for Moderna and roughly about the same in the Pfizer trial. So they were fairly large-scale trials around the world. that were done. Now, we do know from vaccines that 95% of vaccine reactions typically occur in the first week or so. There are local reactions, there may be fever, there may be chills, and that 99% of reactions are occurring probably within the first month or so. So long-term delayed responses and reactions to viruses, to vaccines, are very, very rare to begin with. And therefore, the safety data that we needed was really front-loaded on the front end. And if we know that it's effective and safe on the front end, that gives us a lot of surety that this is a safe way to go in the future there. So that's kind of answers that part of it. I hope I captured all your questions there.
You did. The next one I want to ask, does a messenger RNA vaccine change your DNA?
So the answer is no. So messenger RNA, we produce messenger RNA all the time from our DNA in our cells. The messenger RNA leaves the nucleus, goes into the cytoplasm, and there, using ribosomes, getting down to high school biology here, that's where the protein is being synthesized. So when we are giving a mRNA vaccine, that mRNA is being picked up by our lymphocytes and dendritic cells specifically, and it goes into the cytoplasm. It never enters the nucleus of the cell. And you can't go back from mRNA to make DNA. Now, on the other hand, viruses very often, a lot of viruses, herpes viruses especially, always get into our genetics. They always get into our DNA. That's how we get shingles again and again, because they do incorporate that. So the short answer is the vaccine mRNA can't get into your DNA.
So you mentioned high school biology. Dr. Rowe was nodding his head at that.
It was. I remember that.
Last question for you. I want to turn it over to Kelli Duncan here. We had this was a popular question I got on Twitter today, actually. What type of allergic reactions will get you disqualified from getting the vaccine, or might present some difficulties in patients? Talking maybe food allergies, certain medication allergies, or reactions to previous vaccines.
Sure. So food allergies in general, does appear to be safe. That does not appear to be the issue. There have been some allergic reactions reported, but it does appear that it's not to the vaccine mRNA itself. It's just too small a molecule to develop an allergic reaction to. It's really some of the other chemicals that they have to add to stabilize that mRNA. You gotta remember, mRNA has a very short half-life. It's only in hours, which is why the vaccine needs to be kept at such low temperatures. And once it's thawed, it must be given within hours, because the molecule basically falls apart, which is another reason why it doesn't get into your DNA. But that being said, that it's too small to have an allergic reaction to. So what we do think is that there is some isopropyl ethylene glycol that's in the vaccine as to stabilize the molecule. And if you've had reactions to ethylene glycol in the past, you do need to let your physician know about that. It's not necessary that you can't get the vaccine, but you may need to have some further observation and supervision and weigh some risks and benefits before you do so.
All right, I'll turn it over to Kelli Duncan for a couple of questions.
Great, thanks, John. My first two questions are for Melissa regarding the rollout of phase 1B. Of course, as John mentioned, there has been a lot of, and as you well know, there's been a lot of anticipation around phase 1B. And last week we heard from Susan Karras in a Board of Health meeting that phase 1B in McHenry County was set to start this week. I understand that that is likely most relevant for local pharmacies and hospitals, but can you give us a little bit of an update? Do you guys have a day this week that those phase 1B vaccinations amongst healthcare providers and pharmacies will begin?
Well, we actually have 4 clinics this week. I don't have the specifics on how many of those appointments are dedicated to second dose 1A and how many are dedicated to 1B, but our pharmacy partners, our hospital partners, and community partners are beginning that 1B population. So we are pushing them vaccine so that they can start. Now we are, again, prioritizing the 65 plus because of morbidity and mortality associated with COVID-19. And just to maybe give some perspective, there's roughly 44,000 people in McHenry County who are 65 plus. We had 25,000 people enroll through our online platform, if you will. So it's a huge group. We've had over 90,000 people enroll online, and there's approximately, we estimate about 70,000 or over 70,000 people who are in that 1B, 1C group. So it's a very large group to vaccinate. And so as vaccine starts to come in more regularly, the state is indicating that as more federal supplies come in, we expect this bottleneck to start to open up and get easier for people to find appointments in our community. The hospital systems have already reached out, and I think in some cases, so have the retail pharmacies, to patients. So they are inviting people. They are starting with the most at risk, so they're that 65 plus. And so some people may have received a mailer, a phone call, or even an email inviting them to sign up through those partnerships.
Okay, and quick follow-up question there. Have all of the appointments that have been made for phase 1B thus far this week, has that been all through invitations, or are there any appointments that are open? Are folks able to go on and through the county or through their hospital or healthcare provider, are they able to schedule their own appointment? Or at this point, are we telling people you're going to have to be patient and wait for an invitation to be extended to you?
Well, so all the appointments, regardless of where they're located, so whether they're through us specifically, like a clinic that the Department of Health hosts, or if they're with a medical provider through one of the systems or one of our pharmacy partners, they are by appointment only. The same is true, so the state launched last week coronavirus.illinois.gov, and they have a vaccination location app page within that website where people can go and enter their zip code, enter their city, and find a long list of retail pharmacies in our community. However, it says, there's a disclaimer right at the top that says, until more federal supplies enter the county or enter the state, those appointments will be very limited. And so if people try to click on the links, they may be getting frustrated because they're not seeing clinic appointments associated with each of those retail locations. But as we understand it, as more vaccine comes in, you will start to see those populate. And we're expecting that sooner than later. But I don't have a precise timeline on that.
Okay, and for those people who may be feeling frustrated, your advice might be just keep checking back.
Yeah, and I know that may not be what people want to hear, but we are, so if they've enrolled through us, for example, we will send a link when we have slots available. So we're only pushing out links for appointments for vaccine that we have and for planned clinics based on available vaccine. However, so even if somebody is enrolled through us and they receive a link, but they're able to get an appointment with their medical provider or one of the hospital systems or at a retail pharmacy, we encourage everybody to go ahead and sign up for that appointment. They may still get communications, or they will still get communications from us, but if they can get in somewhere else, by all means, they should sign up for the first available appointment to get their vaccine.
Okay, can I sneak in one more, John, or do you have a few you wanna? Okay, next question. We've heard from a few, as we talk about this prioritization of residents 65 and older and the teachers that will also be vaccinated later this month, I have heard from a few people who are within the broader essential worker group in phase 1B, perhaps a worker at a grocery store, who are a bit disgruntled at feeling like perhaps they are now at the back of the line. So I guess, can you explain, with this new sort of prioritization within the prioritization, is the plan to get through all McHenry County residents 65 years and older, and then all of our county's teachers, and then move on to the rest of phase 1B? or will it look a little bit more flexible than that?
Because it's such a fluid situation, and as vaccine comes in, we hope to expand to, more groups within 1B or broadly the whole 1B priority group. But until there's sufficient vaccine, we have to prioritize within that group. And we're doing it based on with the 65 plus because of the high morbidity and mortality associated with COVID for that group.
Okay, thank you.
I want to go back to Dr. Hafiz for a second. How concerned should we be about these variants? We've seen the UK variant, the South African variant, and then if Dr. Rowe could address maybe how you guys are monitoring this as far as keeping kids in school and maintaining that sort of that balance.
Sure. The variants is certainly something we're keeping an eye on. We do know that viruses such as coronavirus produce variants all the time. Most of the variants are inconsequential. It really doesn't really matter. They're just small changes in their genetic code. However, every once in a while, you can get a genetic variant where it affects the protein molecule on that spike protein we've been talking about. And in the case of the UK B119 variant, what we've seen is that change on that protein actually makes it stickier to the ACE2 receptor in the nose and the lung passages. And therefore, because of that, less virus is needed to actually infect somebody. So in essence, it's become more contagious. What it does appear is that overall the virus may be less virulent. In other words, even though it's stickier, it's more contagious, it may be less deadly. However, those two seem to cancel each other out. If you're spreading more disease, even though you have less mortality, you're probably still getting the same number of people coming into the hospitals and seeking care and stuff. Now, the South African variant seems to be a little bit different. There does seem to be significant mortality with that. The UK variant appears to be close enough where the existing vaccine should be able to cover it, but I think more to be seen on that. A little more concerning is the South African variant and how much the vaccine can cover. However, we do also want to point out that even though there is a variant, it doesn't make the vaccine from 95% effective to 0. It may make it 75, 80%, which is still far above what most other vaccines are. For most other years, like an influenza vaccine or even a pertussis vaccine, if we're looking at 45, 50% effectiveness, that is still significant enough to save lives and reduce the spread of disease. So it's not necessarily a game changer just because there's variants. Point two to that would be that because we use mRNA, even if we had to develop a second type of vaccine, like a Moderna 2 or a Pfizer 2, we could probably do so in about 3 months or so if needed.
Dr. Rowe, how are you guys looking at this variant from the education level and getting kids in schools?
Sure. For us, we focus on the mitigations that we can control. I mean, obviously schools have, a much more controlled environment than most locations. And so therefore the IDPH recommendations and the guidelines that we've all been following of wearing your mask and staying socially distant to the best of your abilities are going to protect you from many aspects of this. So all masks are, of course, mandated in all of our schools, students and staff and visitors. But then also we have all of our desks and as much of our functionality as can be separated by 6 feet of 6 feet guidelines is done so, which is what's restricted us from opening up even further. I mean, we could certainly welcome all of our students back tomorrow, but the 6 feet, the social distancing would be gone. And that's why that remains a slower process. But mostly the mask. I mean, and Dr. Hafiz could probably speak to this. I was collaborating with his colleague, Dr. Nathan at Huntley Hospital recently, who shared with me that the cases of influenza in our county or in our community are dramatically low. single digits even when I spoke with him. And he was amazed at how low it was because we're wearing masks and we're, staying away from the crowds, and probably because, kids are wearing masks in schools, and maybe even in the restrictions that are placed on the interaction that our kids have, who are typically, flu season is a major hurdle for us every year. So I think the mask wearing in our society has become a huge benefit in terms of preventing the spread of not only COVID, but other viruses.
Yeah, Melissa, we seem to have avoided the twin-demic that was potentially forecasted before the flu season started. Can you speak a little bit to the effectiveness of masks maybe on flu and reducing COVID? We see Region 9 maybe on pace to make it to phase 4 by later this week.
Yeah, so the numbers are trending in the right direction. I think as of today, when I checked earlier, as a region, we're at 6.4%. So we've just come down below that 6.5% threshold. So we have to do that consecutively for a few days before the state would move us into the next phase. Yeah, so, we continue to do surveillance. So on top of all the vaccine focus right now, we're still doing the contact tracing, we're still doing case investigation, we're still doing the surveillance. So with regard to flu, it is still flu season. People are encouraged to get their flu vaccine, but there is some suggestion that because of the mask wearing and because of the distancing, flu season hasn't been, what it has typically been in years past. So that's a great thing.
Kelli, go ahead.
Yeah, so I wanted to touch back on something that Dr. Rowe, you said earlier, announcing those 2 dates for mid-February to begin the vaccination of teachers. Of course, that is very exciting because, as you said, we had initially anticipated that being the 3rd or 4th week of February. Can you talk a little bit more about those 2 clinics? It sounds like you have a very aggressive goal of 6,000 doses over those 2 days. Will those be 2 isolated clinics, or is this sort of the start of regular clinics going as long as you guys have doses available to you? Or is this, let's get through 2, see how we do, and then plan the next batch?
Sure. And Melissa may have to jump in on some of this because obviously we were able to coordinate an event with the McHenry County Department of Health's oversight, and they're allocating they're allocating doses specifically for the numbers that we've given to them of the educators that are going to be at our clinics those 2 days. So what we've done is we've separated school districts based on north and south proximity in the county. And then those school districts basically north of Route 176 essentially are going to be going to Woodstock, and those that are south coming to Huntley. And our numbers have balanced out to be just under 3,000 people at each location. So we've communicated that with the health department. They've set aside that number of doses for us for round 1, and then 28 days later we'll repeat that process in a similar fashion. But no, it's just for our events are solely for McHenry County educators and any Group 1B participants who had not, some of our first responders who had not been able to get into the health department clinic in Woodstock. And so our EMS, police, fire, those guys that have not been able to be vaccinated yet. We don't have any plans, at least in the schools, other than the memorandum of understanding that our board passed recently, as other districts have, to be partners down the road for general vaccination sites. Ours specifically was a drive-through vaccination location through our bus barn that we're prepared to implement whenever the health department's ready for it, which obviously depends on the dosage and getting beyond Group 1B.
Okay, I want to make sure that I'm understanding you correctly then. So across these 2 days, the 6,000 group that you've just mentioned, you've done some surveying of your half of the county that Huntley High School is responsible for, and you think that you can get the vast majority of the people who have responded in the positive that they'd like to receive the vaccine done in those 2 days, and then plan another 2 days once you're ready to distribute the second dose. Is that right?
Correct. That is correct. Not
Wow,
the vast
that's
majority. We expect to get everyone
everyone.
in our
Okay.
that are coming to our is signed to come to our clinic. We expect them all to be vaccinated on those 2 days.
And of course, this is outside of your jurisdiction, but I imagine there's quite a bit of coordination between you guys and Woodstock North High School. Will they be hosting clinics on the same days, or are they on a different timeline?
They are on the exact same days.
Okay. I'll kick it back to you, John.
Got a couple of mask-related questions from that we got from some readers, and I think this is probably for either Dr. Hafiz or Melissa. If I'm fully vaccinated, is it safe to gather with people who are also fully vaccinated without masks?
Yeah, I'm hoping eventually, yes. The important thing to know, yes, the vaccines do work. The vaccines are very, very effective. It really depends upon the circulation of the disease in your community. We're already seeing the community numbers starting to drop, and that's a good sign, but we're far from the point where we're going to get away from masking and social distancing. So and to get to large gatherings of people, we really need to see the community numbers drop significantly. However, I do think that, you know, and as we've been managing so far, is to be aware of who's in your personal bubble, of who you're in contact with. Keeping that bubble as small as possible was really practical. And really, if it's down to the household unit, that's the right way to do that. And getting enough people vaccinated, and that certainly gives you the capability of adding a little bit more to that bubble, provided everyone else is vaccinated as well. But it's still, we're not at a point yet to stop masking or universal precautions yet.
I know this sounds like a simple question, but I know there's a lot of complexity to this. When do you think we will stop having masks and social distancing as a requirement? I don't want to hold anybody to any dates or anything like that. I'm just out of curiosity, open-ended question. I know there's a lot of complexity to it, but just.
There is a lot.
Yeah.
And Melissa may be able to add a little bit more to that, but it's really not about a date, but it's really, again, the number of circulating cases. What I would want to probably see is that we've reached a threshold of vaccination. Probably it's going to be close to 70% at the least, closer to 80% of the community vaccinated, to have enough people therefore you've got enough herd immunity that you will start to make a big impact on the virus just can't circulate because there's nobody to circulate it to. And with that, what we want to see is the numbers start to drop off. But say, for example, we can, again, I'm just pulling this number out of a hat. If we can go 30 days, 60 days without a single case in the community, or very low numbers in the community, then we know that it's making an impact. And that's probably at a point when, you know, state and county health authorities will start making those conversations about, okay, what is that next phase going to look like? But we need to stop seeing those cases for a period of time. A day or a week is probably not enough. We want to see it longer than that.
Melissa, is that about where you are on this?
Yeah, so I'll just add to, so in our plan and the targets that we have set it at that 80% threshold for herd immunity. So as Dr. Hafiz said, it's gonna take a while. We're gonna have these mitigations that we've gotten used to: the masking, the distancing, the hand washing, the gathering sizes. You know, being cognizant of that, because it is going to, you know, take a while to get through vaccinating our population. So just maybe this is helpful. Maybe it adds to the frustration, but statewide, so as of today, you know, the state has posted on its vaccination data page that we are close to 1 million people who have received vaccine in the state. We only have 1.72% of the population that's fully vaccinated, right? So we have a long way to go. So again, as the vaccine starts rolling in larger numbers and more opportunities to get vaccination start to open up, we should see that number just start to grow and grow and grow. And if you look at the graph, it is going in the right direction, right? But some perspective on, we've really only been doing this, at least locally, for this is now our going into our 5th week. And the state as a whole, is more like, 6 weeks, 7 weeks.
Yeah. While we're on the path of long horizon questions, Dr. Rowe, I don't know if you saw that last week, Dr. Fauci said he envisions kids as young as 12 getting vaccinated, sometime this summer. Obviously, there's a lot going on right now. There are a lot of steps to go through to even get to that point. But as you start to look ahead to the fall, children getting the vaccine, is that something that's on your radar within McHenry County schools?
It is. It is. Currently, each school district and how they plan for and require vaccinations of students is different. Speaking for our school district follows which vaccines are required by the health department or the Illinois Department of Public Health as what vaccinations we would require in terms of attending school. So our policy currently does not have anything written for that, and we would wait for IDPH to give us their opinion as to whether it should be a requirement. That said, we take all kids, no matter what, no matter where they come from, no matter what they've got going on, and we care for them. So we'll be here ready to help them whenever next school year rolls around and whatever comes with it.
And I know a lot more to come on that, a lot of discussion.
Yes, there will be. There's a lot of information that will come between probably spring break and late June in terms of what next year looks like. I hope the Illinois Department of Public Health and the Illinois State Board of Education puts their heads together early and often, so that way we're not waiting until the 11th hour with constantly changing guidelines now that we have as much information as we do, so we can adequately plan and give our communities what they need in the fall, which is as close to full attendance as we can possibly get.
All right, I'll turn it back over to Kelly for our last set of questions.
Great. Melissa, I'd love to just get granular on the rollout of phase 1B one more time, if you'll indulge me. We've gotten a lot of questions, folks who are in the 65 and over population seem especially interested in getting the vaccine as absolutely soon as possible. You touched on this a little bit earlier as far as where they can get more information, but specifically for people in that population that may not have a primary care provider or a specialist with Northwestern Medicine, Mercy Health, or Advocate Aurora Health, where they could be invited to sign up for an appointment, they would then default to, are you having trouble with your audio over there, Melissa? All right, well, Melissa, maybe I'll circle back with you. I did have one other, I think it'll be a relatively quick question for Dr. Hafiz. I was just wondering, sort of more for curiosity's sake, now that among the Northwestern Medicine population, you guys have seen, all of your healthcare providers have received at least their first dose of the COVID-19 vaccine, and it's my impression that a good amount have received their second dose and are now fully vaccinated. I was just wondering, how has that changed the atmosphere at all within your hospitals and specifically within your COVID-19 units? Have you seen the impact of that yet on how many doctors and staff are coming down with infections, on a weekly or, broader basis? And what has sort of been the impact of getting to that moment?
Sure. It's actually, we've been seeing a lot of enthusiasm from the staff. In fact, as was pointed out by Melissa earlier, McHenry County was a little bit slow to get their allocation because of the rates in our community. So a lot of our physicians and nursing staff were able to go to other areas and to get their vaccination. I waited till it was available here at Huntley, so I got mine here. But you could feel excitement in the room. There were the staff getting their vaccine. It just felt like a point of relief that finally we have a tool at our disposal to start to keep our staff safe, and hopefully we can start to quickly expand that to our patients as well. To your other question about staff getting sick, we did have a few staff early in the year get ill with COVID. But and through the summer it was really low. However, in the fall, when we did see that October, November ramp up, we did see a fair number of staff as well get ill. But it does appear from what we looked at, it really wasn't from patients directly. It was really getting ill from either a spouse or a family member or a friend that had it. And we started to see that as well come around in October, November-ish or so. That being said, getting our staff vaccinated on those units, and even if you don't work on a COVID unit, getting vaccinated has just put a real big relief in the hearts of our staff there. That being said, we have not changed our personal protection equipment requirements of masks and eye shields and gowns and gloves. None of that changes based on what I was talking about earlier. Until the numbers go down, we are not going to make any recommendations on that. So all those precautions will continue regardless of how safe we know and effective the vaccination is.
Great, thank you. And back to you then, Melissa. The question that I was asking earlier was for those McHenry County residents of 65 years and up that don't have a healthcare provider with one of the major hospital systems in the county and are interested in getting the vaccine. You know, it's my understanding that they would then, you know, have to seek that through a local pharmacy. But walk me through, you know, are there any other options? And within getting a vaccine from a pharmacy, do I have to go to my pharmacy if I'm a customer of CVS or Walgreens? Are CVS, Walgreens, and Jewel Osco my only options? Are there others? You know, what should I do if I'm in that situation?
Sure, and sorry about that. Oh, yeah, apologies. The phone just went dead on me. So we, a couple of things. So we're starting a call center this week so people can call us and we can help link them and walk them through some of those processes. I have not read that you have to be a client, if you will, or a patient of a particular pharmacy. I believe you can go anywhere. The pharmacies do look different though in terms of the process, and I can't right now state that I know what each one looks like. You know, Walgreens has a certain process, Jewel Osco has a certain process, but the state, if you go to that coronavirus.illinois.gov, you know, it says right there that they're adding state and federal partnerships continuously. We hear the state tell us that other national retailers like Walmart, Mariano's, and other places, CVS, you know, are going to be coming online where people can go. So I would expect at some point there's going to be many, many opportunities for people to go into a retailer or storefront, if you will, and get vaccinated. Meanwhile, we will still continue to send links to people in that 65 plus population, for example, when we have availability in our clinics. So it's not an absolute that you have to go to these other places. It's just that there are more options available to people, and those people who already do have a relationship with a provider, that provider is going to know about their medical history, you know, and have more background on that individual. So there should be many opportunities for people to seek vaccination once we get past this bottleneck that we're in right now with the availability of vaccine.
Okay, and one more question for you, Melissa. As you just stated, you know, it seems, and correct me if I'm wrong here, but it seems that the main challenge to really getting this rollout moving at a faster pace is the availability of the physical vaccine doses themselves. But you have also previously mentioned, I think it was in a McHenry County board meeting, about the need as we expand out into, you know, much larger phase 1C, phase 2, eventually, the need for additional resources in expanding McHenry County's vaccine distribution when it comes to that point. If you could just go over, you know, what is the McHenry County Department of Health doing right now to secure more funding and more resources for when we are at that point?
Sure. So funding was just announced. Don't quote me. I don't know if it was last week or the week before. I can't remember because time is a little accelerated for me right now. But the state is pushing out a grant that is specific to the vaccine rollout. So there will be additional resources available through that. In addition, we have, through making various requests, we have volunteer opportunities through our medical reserve course. So we are recruiting, the schools have helped us. They pushed out a lot of that information to their networks, right? And so we've had a tremendous response from people to add to our capabilities. Our staffing, am I still here? Okay, yeah, thank you. Sorry, the phone is making funny noises. I thought I got cut off again. So that, anybody who's interested in participating in the Medical Reserve Corps can come to our website under volunteer opportunities and complete an application. In addition, the state has some additional resources through National Guard requests, for example, so we're putting in those requests as well to look at larger mass vaccination opportunities for McHenry County.
All right, well, thank you to everybody on the panel today for your time. This is a very important topic. I think there was a lot of great information that we can get out today. So thank you again for your time, and everybody stay safe out there.
Thank
Likewise,
you.
thank you.